How many of you remember when we used to serve alcohol in the hospital? I was talking about this with some of my nurse friends the other day, and some of them had never worked in a hospital that served alcohol. For my non-healthcare worker friends, let me explain. When an alcohol-dependent patient came into the hospital for an unrelated issue, we do not want that person to go through withdrawals while they're trying to heal from something else, because it can be very dangerous. It used to be that when an alcohol dependent person came into the hospital and they had no intentions to detox, then many hospitals would just serve them alcohol to keep them stable. But the hospital is a hospital, right? So we would serve the most off-brand, cheapest, grossest beer and alcohol you could ever imagine. In the hospital that I worked at first, it was dietary that brought up this alcohol on the patient's trays. But eventually, the hospital decided that they wanted pharmacy to be in charge of the alcohol. And I used to work on a floor of the hospital that was split between cancer patients, oncology, and med-surg, which is just like the general population of the hospital. So I have very fond memories of our chemotherapy pharmacist who used to come up to our unit holding these very complex chemo drugs in one arm and a case of beer in the other arm, looking like he's going to a frat party. Anyway, most hospitals do not serve alcohol anymore. They just put you on medications to try to help with the withdrawals, but fun times.